And here we are in the patient waiting area at our Olanchito inner city clinic. Not a city like the United States, but it's still a city. People waiting to get in, and you can see in the background the various stations back there with the clinicians with eyeglasses, injection station, and it's going very smoothly. And here we have Phyllis, a translator, doing the registrations of patients coming in. Here comes a mom and her little baby. Here are Suzanne on the right and Stephanie on the left, doing vital signs, checking for high blood pressure, and also checking for, if somebody says have the fever, let's find out exactly what type of fever they have. And here we have Dr. Mariella, a Honduran doctor on the right, and that is Jen on the left there, a Quinnipiac PA student. Jen had been with me a few months ago in Nicaragua. She is extremely good at doing this type of work. And here we have Quinnipiac PA students, Keelan on the left and Courtney on the right, with their translators and doing patients. And they are very comfortable in what they're doing. Quinnipiac does a great job of bringing these young ladies and PA students along. And here we have our eyeglass station, and that tall gentleman in the back is Tim, and he's a Navy pilot. And that is Lorraine on the left there, very active in rotary water and water clean projects. And here we have our pharmacy area, busy filling prescriptions from the clinicians. And here we have our injection clinic, and that is Dr. Goforth, and that is Desiree. And Desiree is a PA from the Midwest. And here we have Sarah on the left and Nancy on the right, and they are giving out vitamins and deworming medicines. And this is Taylor, and Taylor is an MD from Jacksonville, Florida. She is Tim, the Navy pilot's wife, and she is a family practice MD. And this gives you a good view of the entire clinic area. Again, this is the inside of a church hall here in Olanchito, and is very not typical of the locations that we usually have when we go out into the mountains. But this is a real pleasure to have a facility like this. And here is David Random, reports with Hampshire, doing his oral hygiene puppet show for the kids.
Now, Señor Cameo, basta. Vaya y encuentre su cepillo de dientes. Los dientes atrás. No te olvides de limpiarte la lengua. Me hace cosquillas.
And here we are out in the mountainous village of El Palmera, and it actually took us well over 2 hours to get here through some beautiful, beautiful country. And that little mud shack you see there is where the village health worker is stationed for this particular village, and that was something that we set up here a couple of years ago. And here again in Palmera, we can see how we're setting up in our clinic, and it's basically sheets and plastic around on sticks with a dirt floor. And here we have Keelan from Quinnipiac with a patient. I should say with the patient's family. And we have Jen, also from Quinnipiac, and Jen and I have done a prior trip in Nicaragua, and she's very experienced at doing this type of work. And here we are at the eyeglass station, fitting eyeglasses, which are always a very important contribution in these communities because they have really no access to eyeglasses whatsoever. And here we are with Dr. Clint, MD from Florida. Needed a spacer in order to do some albuterol for a very sick young man. We didn't have a spacer, came up with the idea of the bottle, added the inhaler on the end, and we have a child that is getting better and we're about to continue the treatment by taking the baby to the hospital. Quint, nice job. And here we are having a clinic in El Encino in Honduras, and you're looking there with our back to us is Courtney, to our right is Keelan, both Quinnipiac PA students. That is my friend Jerry Lang, MD from New Hampshire, up in the corner there. And that is Gretchen in the back and her daughter doing pharmacy. And I'm going to just move over here gently for you, I hope. And there is Jen, also a student from Quinnipiac. And you can see Dr. Mariella, and you can see Desiree, who is a PA from the Midwest. And coming over here, you can see the patients waiting to be seen.
Me siento muy alegre y agradecida con Dios en primer
The village
lugar
thanks us for coming to help them out today.
por habernos
We're going to have to tow the bus across this particular river, and that's what they're doing now. We're going to hook our minibus up here to the 4x4 in order to get across. And here we
Dale un poquito de
go.
espacio ahí en la caída.
Maybe not. Here we are at morning breakfast in Olanchito. This is actually a house of Rosemary, and Rosemary is a parishioner in the parish here, and she puts herself out to put out some very, very fine meals for us twice a day, breakfast and dinner. And here we are getting ready to go home, and this is where we stayed last night, and it's a Vim tradition to spend the last night decompressing at a nice place like this, and the beach is right behind me, the Caribbean, and everybody had a great time. Food was great, rooms were terrific, and there was hot water. And the pool at the place we're staying here on our last night. Beautiful place. We'd love to just come back here just for vacation. And here we are having breakfast on that last day. And as soon as we have breakfast here, we're going to do some quick shopping and head for the airport. And here's the other table with 24 people, 24 Americans, and plus our Honduran friends, so we have a large group to accommodate.